it was stated earlier that 54% of the folks who are eligible are working. Is that a correct number? So 46% are not, but these are folks from in what age range?
These are individuals from 19 through 64 who are below 138% of the federal poverty level.
And half of them are not working.
And what we've seen, for example, in Nevada, who has extended coverage to this population, is that a fairly large percentage of the individuals who are not working have mental health problems. They've actually seen in their state-funded mental health services prior to expansion that they had 20% of individuals who had insurance and 80% who did not, and that ratio is completely flipped with extending coverage. So yes, there's a mix of individuals, able-bodied individuals who are working. There's also a mix of individuals who, as a result of healthcare conditions and mental health conditions, may not be working, but perhaps with good medical care could return to the workforce.
And what other federally subsidized programs, whether medical or otherwise, can we point to show or to demonstrate the success that we anticipate to have in Insure Tennessee? Y'all may have the same list I do. There's none.
I'm not sure I'm following exactly what the intent of your question is. There are certainly studies out there that show that the impact of healthy incentives, and as an example, can result in improved health and decreased costs. But I'm not sure if that's getting at exactly what you're...
And I would add, some of the points you're making, Representative, are exactly why we think we've got to move in this direction. You're right. A lot of the times you look at government programs, we could talk about some of the things that Commissioner Hatter wants to do in SNAP and some of the other programs there. We're actually moving folks into outcomes that are healthier outcomes off of this program into ultimately being employed and have private insurance. So we would concur that there are not a lot of good examples of government programs. There are good examples, good research to show that these type of principles are what moves people. So we would agree with you, and that's why we're suggesting this is really hard, but we're trying to suggest you got to take a long-term view here, and we're only going to get where we need to be in running government programs if we can try some of these things out and show that they can work. And again, we're going to need some help ultimately in getting more flexibility on our traditional Medicaid program, because we'd like to take these principles and put them into play there as well. That's how ultimately we're going to have healthier people. That's how these people are going to get the folks that are struggling through their health or mental health to have or sustain a job. We've got to get in that direction and get these folks out off of the programs.
I hope that works out if it passes, but I don't see a track record where typically government gets involved and they have that type of success. I think, as was stated earlier from some other showings and findings, that typically when we give something away at no cost, it's overutilized and undervalued, just like any commodity. And I think we actually are in a process of leading people to more government dependency, less independency for themselves. And ultimately, when people are more dependent, they're less accountable to themselves and to others. And I believe that's the trend that, unfortunately, this waiver will allow us to go. I've got one last question.
Can I make a real quick?
Sure, absolutely.
Another example. I think your point on accountability is exactly right. Where you were going on accountability, I think you've hit it on the head. So the best example I think we could give is where we've gone in education in Tennessee. And so we've moved to a system of accountability, and we've seen results we've never had in the past. So we would argue that has been a big problem of government programs, because we haven't had the accountability. We haven't had people pushing towards results. So agree with you. You're skeptical of this. We think we've got to go in this direction, or government's going to continue to spin its wheels in the current programs we have.
One rebuttal to your statement. If a teacher doesn't move in the direction that we want him or her to go, we can fire them. We can't fire these people.
Yeah, I was talking about the broader accountability piece in what you're saying as far as that in government programs.
But there has to be some motivation for accountability, and I don't see that motivation in this waiver.
Representative, if I could add one thing, you're talking about the consequences of giving something away, and we would agree, and that's why we've structured this so that we're not giving anything away. I mean, you're talking about the difference between commercial health insurance and government health insurance, and we would contend that the two options created through insured tenancy are as much like commercial health insurance as we can make them. I mean, one is buying employer-sponsored insurance, which is private insurance, and the other option includes premiums, new medical copays, and an HRA-like feature. I mean, they're designed to be commercial health insurance-like experiences, so we would agree with that.